We are live now. Fantastic. Hey, everybody. Welcome. This is Dr. David from El Paso Manual Physical Therapy. We're going to be talking about the best 3 exercise tips to repair knee cartilage. So if you have a knee cartilage problem like osteoarthritis in your knee, meniscus tear as well, and possibly chondromalacia patella, that's also cartilage damage behind the kneecap inside the knee joint. So if you have questions today regarding any of those problems that I mentioned, osteoarthritis in the knee, meniscus problems, or chondromalacia patella, or other knee issues too, like we talk about patellofemoral pain syndrome, ACL problems, MCL problems. I can help you out with that today. I want you to drop comments on here, ask questions. So I've got my comments right here. I can see them, and my team's here highlighting comments for me. So I want to be able to answer your guys' questions as I'm giving you some important teaching to help you with exercises for healing knee cartilage, the principles behind it, because you got to know why. You can't just do exercises and not understand why. That's a big deal. That's what a lot of people do, is they just get told exercises and there isn't really a good solid reason besides it's strengthening the knee. This is what you're supposed to do. It's kind of some superficial answer, and it's important for you to understand why you're doing it. And then let's talk about ways to make it worse, because if you can understand the other extreme, you know, what do you do to make this problem worse, then you can know what to stay away from. So that's what I want to help you guys out with here today. So let's check in to see who's here. Guys, if you are on with us live right now, comment where you're from. We got some people already answering here. It looks like Roseanne's on here saying, oh, she became a member. Fantastic. We have a channel membership if you're on YouTube. We're streaming on YouTube, Facebook, and Instagram. But if you wanted to become a channel member, what we do with you guys is we give you priority in answering your comments. If you leave any comments anywhere on our YouTube channel. We have people helping us out with answering comments, and so we try to get back to everyone, but we definitely get back to the members first. So thank you, Roseanne. We got Cindy here from Odessa, Texas. Oh, just down the road from us in West Texas. Fantastic. Julie's here from Sydney, Australia. Always a pleasure to see you, Julie. We got Mina. I remember you, Mina. She says, Dr. David, I missed you in the last live. I bought the knee arthritis program today, though I have chondromalacia too. I think I am somewhere in between phase 2 and phase 3, fully able to activate glutes. Fantastic. That's awesome that you can activate glutes. That's going to definitely give you a leg up, no pun intended. But you got to make sure that you're doing the other parts of the program to take care of this. So if you have knee arthritis and chondromalacia patella, you're in the right program, being in the knee arthritis recovery program, and it's going to fix both because it's designed to fix all these problems because they're connected, as you'll get a bit more about how the connection works here in my explanation today. Oh, we got a second part for Mina's comment. What else do you need to tell me, Mina? Oh, she says, I am 32. The goal was not to let chondromalacia turn into arthritis. My knees mostly hurt after standing for long stairs or walk for long. Are there quads involved in the pain? Why do my quads pain? Yeah. So I'm so sorry you're dealing with this at such a young age, 32. But it does turn into arthritis. You know, if you don't take care of the muscle imbalance and get pressure off the kneecap, then you start to have changes in the cartilage and on not only on the kneecap right here for chondromalacia patella, but also on the thigh bone where the bones touch. And so, yeah, when you stand, if you're quad muscle dominant, those are the muscles in the front of the thigh. If you tend to use those more, it's a compensation because you usually don't have enough strength in the glutes. Could be in the feet. It's very often the glutes, though. There might be abdominal muscle weakness as well. If you have that compensation and your quads end up taking over more, then you just get a lot of pulling of the kneecap. And because the tendon connects all the way down to the shin bone, it pulls the shin bone up into the thigh bone. And so when you're standing for long periods of time, when you go to do stairs, you're just rubbing the tissues there excessively because you're already dominant in the quads. So fixing that imbalance is going to be huge for you. The fact that you are already using your glutes, though, that you have conscious control over them, we'll be talking a bit more about that. That's setting you a few steps ahead. So you should go fast with the program. Plus, it helps that you're a little bit younger. The problem tends to not be as bad at your age versus somebody who's in their 50s or 60s or older. So let's get going, Mina. I hope to see you on the weekly group coaching calls for the knee arthritis recovery program. I will be on next week. We got one of our coaches on this week. We got Shirley in Central Iowa. Hey, Shirley, welcome to the live stream. Caroline is in the UK. Hey, Caroline, welcome to the live stream. I love the heart. We got Carmen in Germany. Awesome. We got Europe represented here. Julie Parker says, pen and paper ready. She's ready to go, ready to take some notes here. And she also says, David, I am starting to be able to engage my glutes when walking. Awesome. But still struggle and painfully around the grocery store. Julie, it sounds like you're right where you need to be. It is a struggle. Everything's hard before it becomes easy. That is a fact. I mean, it's rare that you're just a natural at something and excellent at doing something. And when it comes to this muscle imbalance where your glutes get amnesia, they call it glute amnesia sometimes, like they just forget to work. They forget how to be glutes. They're just kind of going along for the ride. Meanwhile, the quads are taking over. It is very conscious, active effort on your part to make them work and then get their strength up and get their endurance up so that they can last to the grocery store. And it's not so bad. You actually feel just fine after going through maybe even multiple stores in one shot. So you're almost there, Julie. Keep going. Lightning the Way Ministries says, Derek from Oregon. Fantastic. Oregon's in the house. We got the Pacific Northwest. Rua Water Walker is in Southwest Florida. Cool. Both corners of the country are here. Awesome. Westlaco. Karen is in Westlaco. Awesome. Thanks for joining us, Karen. And then we got Cheryl here from Indiana. The Midwest is here as well. Cheryl Boucher. Awesome. And we got Lori Wilson tuning in for my weekly pep talk. Oh, awesome. I'm glad to give you a pep talk, Lori. Anne is here from the UK as well. Lots of UK people. Thank y'all for joining us from Europe. Cindy says, hi, Dr. David from Josephine, Texas, a fellow Texan. OB, that's a relief. Hi, Dr. David. Helena from Sydney, Australia. We got more Australians here. That is so cool. It boggles my mind that we're all over the world helping people out. All right, we got Cindy Kite King says, question. This may sound really dumb, but I do not know exactly how to use the walker. I have issues with both hips. Do I roll the walker and walk or lean on it and take both legs at the same time? And the follow-up to that is I am in just stage 1 of the hip exercises, offloading. I do the leg wiggles and the glute exercises too. Fantastic. Can I show her how to do this? Is that okay? All right. Let's help you out, Cindy, because I got a walker right here. And I'll show you what I mean. I know you said both legs hurt you. So here's how you would do this. The point of using the walker whenever you're going to offload, because you said you're in phase 1 when you're offloading, number one thing you want to start with is make sure that the walker is adjusted properly. Because as you can see, if I just rest my hand on my side, the handle should be about where my pocket rests on my pants or close to there. And the reason for that is because when you put your hand on the walker, you need there to be a little bit of a bend in your elbow. So if you look at my elbow here, there's a little bit of bend. And the reason for that is so that when you lean onto it, you have some room to push your elbow down like that, or straighten out your arm, push your hand down and straighten out your elbow. And that gives you the support to take pressure off your hips and anywhere else you're offloading, your knees or your feet. All right, so then when you walk, here's the goal. If you see the full picture here, my whole body, you basically just want to reduce the pressure you're putting on your legs. So you're going to move the walker forward, take a step, and then bring the other foot. Move walker forward, take a step, bring the other foot. It doesn't really matter which foot you're bringing forward. The goal here is to just make sure that you're taking pressure off whenever you're moving. Now, I'm walking really slow here. I don't have a lot of space to walk. But if you're doing this out in your home, in public, it's okay to move a bit faster. Just the idea is when you're going to see right here, I'm moving the walker forward. Now I'm going to bring my legs forward. I want to lean on the walker as much as possible so that I can bring my legs forward, putting less weight on there. Don't worry about getting hung up on, which leg to bring forward, but you do want to move one leg at a time, whether it's the right or the left, it doesn't matter. What I don't want you to do, Cindy, is a little dangerous, is if you swing both legs like this. That's not ideal. I mean, you could do it if you feel comfortable and you're not going to fall. My biggest concern for everybody is that you're safe. And if you just move one foot at a time, you're going to be a little better balanced than if you're trying to bring both legs like a kangaroo or a bunny. You want to make sure you bring one leg at a time. Hope that helps you out there, Cindy. All right. I'm gonna go with more questions. We got, who else is here? We got Carlos Posada from Fresno, California. Awesome. West Coast is well represented. Bambi Jacobs is in Florida. Florida's in the house. Hi, David. God bless you from Lake Placid, Florida. Awesome. That's Teresa. Thanks for joining us, Teresa. We have another Teresa from Bridgewater, Virginia. So cool. All right. Let's take a break from that and get going over here, guys. So let's talk about my best 3 exercise tips to heal knee cartilage. We're talking about conditions, especially like knee osteoarthritis, meniscus tears. This is the meniscus right here. And then chondromalacia patella. The patella is the kneecap, and chondromalacia means the cartilage behind it is becoming damaged. All of these conditions happen as a result of some muscle imbalances. I'll go into it more, but let's talk through the exercises, the principles behind the exercises, and ways to worsen the problem so that you know what you shouldn't be doing. All right, so number 1 here, let's talk exercises. This is my number 1 go-to exercise for a cartilage problem in the knee. It's called tailgate swings. That's right, swings. And I'll show you in just a moment what this is, but let me just talk about the principle behind it because let me pick a color here. The number 1 principle behind tailgate swings is that you're doing high repetitions. And this is important because to heal cartilage, you have to understand what its purpose is. I'll show you the exercise in just a minute. Cartilage is a layer of tissue that's a little bit soft, but still rigid. And it covers the end of a bone where that bone connects to another bone at a joint. In the knee joint, specifically, there's 3 main bones that we talk about. There's this little 4th one, but it's not as important when we're talking about like chondromalacia patella, osteoarthritis of the knee, or meniscus tears. It's really the kneecap, because that kneecap has cartilage right behind it, and it interfaces or it touches the cartilage on the surface of the thigh bone. And then on knee osteoarthritis, this cartilage can get affected. It could be your kneecap as well. And then in a meniscus tear, you have the meniscus itself, which is also cartilage. You have an extra layer of cartilage cushioning the thigh bone on the shin bone, and that could tear and can cause you some problems. And it can heal, but we have to follow some principles. So the principle is high repetitions, and let me write it down for you here. Low resistance when it comes to exercise. In other words, we need a lot of reps, high repetition, and low resistance, very low weight or very low pressure going through the cartilage. What that does is, keep in mind, cartilage is living tissue. And when you're doing something like tailgate swings, you're basically bending your knee back and forth just like this. And because you're not standing, it takes off a lot of resistance. So it's low resistance. And you don't need to count reps. Actually, I'll show you what it looks like in just a moment. When you're bending your knee back and forth like this, you're getting high reps with low resistance. And what that does to the cartilage cells is it stimulates them to heal. You need mechanical force like this going through your cartilage in order to communicate to the cells. The movement communicates to the cells that we're doing something good for you here. We need to heal. That's just one part of it. You also are moving the fluid inside the joint. There's fluid that lubricates the cartilage, and it helps to cushion a little bit. It has many purposes, but it also brings nutrition to the cartilage, and it takes away waste products from the cartilage. As it heals, it develops waste products, and it needs new oxygen, new proteins, fats, carbohydrates, all the other vitamins and minerals that it needs. When you take those supplements like glucosamine, chondroitin, MSM, hyaluronic acid, when you take all those supplements, if that's something that you're doing, you help to get it into the cartilage so that it can heal properly if you're doing low resistance, high repetition movements. So this is what it looks like, tailgate swings, in case you've never seen this before. Let me just show you here. You're just sitting somewhere where your legs dangle. Ideally, you can sit on some pillows or something that just elevates you. Or if you have a computer chair, raise it all the way up. And all you're doing is swinging your legs back and forth. You can swing them together. You can swing them opposite, one forward, one back. I'm not doing anything strenuous here. I'm not going really fast. I'm just taking it easy. And all I'm doing inside the knee joint is moving that fluid and communicating to my cartilage in my knee, hey, I need to heal. If you have a knee injury, that's what you're telling your knee joint is we're doing some easy stuff. It's okay. You're not putting your full body weight. You're not doing anything that's got a lot of resistance. We just need to get some easy movement in there to tell your cartilage, let's get healing. Let's get going. The point of cartilage is to take forces, but we have to do it in a smaller way at the beginning when we're trying to heal it. So what I tell people to do is 5 minutes or more every hour while you're in early phases of our program. So we talk about like the knee arthritis recovery program, the knee meniscus recovery program. We have the patella pain recovery program for chondromalacia patella. All these programs involve tailgate swinging to get the cartilage to begin to heal in phase 1 of the program. This is where you start to get things feeling better. And we have people all the time tell us, yeah, I started doing the tailgate swings and my pain's actually going down. I've had people that we've talked to in our programs over the internet, through YouTube comments, in person when they come in, and they say, I went and got injections, I did this treatment, I did that treatment, and yeah, it mildly helped, but I did tailgate swings every hour like you told me to for 5 minutes at a time, as long as it doesn't hurt. I'll tell you more about that. And it's the best I've ever felt. This is such an underrated exercise, and it looks so simple. This is kind of my MO, if you will, like my reputation is I have simple exercises, but when you do them right, when you implement them correctly at the right amount of time, when you follow the instructions that I'm giving you, basically, it is highly effective. So tailgate swings, that's the first exercise that I would do for cartilage problems. Hey guys, I want to let you know that our helpline is open right now. So yeah, the number on the screen, if you look down here, you can call our helpline. If you have a question, I would love to get on the phone with you and answer your question live here while we're on YouTube. The number is 915-200-4159. That's 915-200-4159. If you have a question, if you're stuck somehow, if you have a knee issue especially, I'd love to talk to you to get you unstuck and make sure that you're healing naturally and avoiding surgery and getting back to being active. All right, so you saw there, I was tailgate swinging as I was talking about calling us, and it doesn't take much effort. So I tell people all the time, do this while you're watching TV. Do this while you're having a meal. Do this while you're doing something else. It doesn't have to be an exercise that takes all your focus and all your attention. It's nice and easy. And if anything, you should just feel like your legs warmed up. It shouldn't feel like you're sweating or like you're straining to do this exercise. It should be pretty subtle for you, pretty low key, as the youngsters say these days. And it should feel like you're better afterwards, like you're mildly better, but you really get the improvements when you do it hour after hour after hour, because if you just do this once or twice a day, it's not enough. Remember, we need high repetitions. So doing it for 5 minutes is not enough. What the research shows is you need thousands of repetitions, not 30, not 50, not 100, not even 200, not 500, thousands. So just think of getting 1,000 repetitions in. That'll take you a while. And if you do it all at once, it might be a little aggressive for you. You might not be able to tolerate it today. 1,000 reps all at once or 2,000 reps all in one shot, that would take you potentially 10, 20, 30 minutes. But if you do 5 minutes at a time every hour, and if you can't do 5 minutes today, start with 30 seconds. Do a minute. Work your way up to 5 minutes. The point that I want to stress here, another principle is, I have 4 principles, is tolerance. You need to work within your tolerance. In other words, I don't want you to overdo it. I don't want you to, because I've had some people that say tailgate swings hurt. And then when we dig, we start saying, all right, well, tell me more. how'd you do them? And I'll have them show me, and they'll show me just like I showed you a moment ago. And then I'll say, okay, how often did you do it? Every hour. Okay, that's right. Did you start to get pain as you started the day? No. How about middle of the day? Yeah, I kind of started. Did you keep going? Yeah, I kept going because you said to do it every hour. But what they miss is I also said to your tolerance. So if you start doing them at, let's say, 8 o'clock in the morning, and you're doing them every hour on the hour, and then you get to 12 noon and you're saying, my knees are getting a little achy. It's starting to hurt. You're done. Stop, because you've reached your tolerance. I don't want you to keep doing tailgate swings through pain. I want you to stop when you hit your tolerance. And you may stop for the day, or you may just skip an hour or 2 or 3. You may try again later on at 4 o'clock. And then you might feel up to it and feel fine, no pain. And if you hit that threshold again where you start to get a little bit of discomfort, stop. And what you should see is you stimulated the cartilage. You put some very low resistance to the cartilage. You did lots of reps, and you allowed that cartilage to work within its tolerance. And what you should see as the days go by is an improvement. Oh, you can take a bit more time on your feet. You can take a bit more walking. You can take a bit more stairs, and it doesn't get aggravated as quickly, because that is how you strengthen cartilage. Right now, healthy cartilage, if you didn't have any knee problems, you should be able to do a lot. I mean, you see people jumping from high surfaces down and landing, picking up heavy weights, doing squats or deadlifts. How do their knees not hurt? It's because their cartilage can take it. And as they get stronger, they can do more resistance. They can put on more weights. They can jump from higher surfaces down. But it's by stimulating the cartilage. And somebody like that, though, like I ran 3 miles this morning. So think of all the pounding, and I'm 240 pounds. I'm not a light person. I'm 6'2". I'm a tall person too. If you look at me, I don't look like a distance runner. I look like a football player. But I can do some distance running. It's because I've built my way up into it gradually, and I can tolerate 5, 6 miles, maybe even 7 or 8 miles, all in one shot if I wanted to. But once I hit that threshold for my current cartilage level, then things start to hurt. But I'm okay with stopping at that point. Now, if you have an injury, though, you have cartilage damage because you have arthritis, a meniscus tear, or chondromalacia patella, your tolerance might be right now that you can only walk for 5 minutes on a walker. But if you do the right things like tailgate swinging and you're offloading adequately, then you should be able to climb up to 6 minutes, 7 minutes, 10 minutes, 20, 30, an hour or 2 over time, because you're doing high repetitions, low resistance to your tolerance, and start with tailgate swings. All right, I'll tell you the second exercise in just a moment. Let's get to some comments here first. We got some questions. Tailgate swings help, but I have spondylolisthesis and they hurt my low back. Any suggestions? Yes, absolutely. You need to work on your core. If you have spondylolisthesis, yeah, I have my spine model here. What that means, I might need to go to the skeleton here in a second. Can we go over there actually? That'll be better. Just for everyone's knowledge and for the person asking this on the comments. So spondylolisthesis has to do with the lower back here. And I can't move these vertebrae because they're all, pinned together for the skeleton to stay up. But if you think of what this looks like right here, this is like the same vertebrae that are down here. These are just a lot bigger. In spondylolisthesis, one of the vertebrae is shifting forward like so, and it starts to pinch nerves. It can cause pain in the joints right here. It just pushes on things. If it gets really bad, you can get a break or you can get some serious problems. There's usually disc issues. But the reason why that bone shifts forward is because there's an imbalance in the area. And the number one imbalance that causes spondylolisthesis is over-dominant back muscles. The muscles that run up and down the back here, they're so strong that they're clamping down the bones here, and they're causing one to pop forward. And the reason why they're overactive is because on the front side, the lower abdominals usually aren't strong enough. And so these are compensating back here. But if you have better strength in your lower abdominals, what it does is it yanks because the abdominals come up to the rib cage. It pulls this rib cage down a bit, and it pulls this part right here. This is where the abs attach on the front of the pelvis. It pulls the pelvis forward. And I don't know if you can see that, but if you pull the rib cage down, the pelvis forward, it offloads the back. And it doesn't make these back muscles work so much, which then allows that bone to shift back into its proper position, and it can alleviate spondylolisthesis and fix it for the long term. So you got another problem that you're dealing with that seems to be more of a priority in this case, and it comes back to lower abdominal strength, which I talk about in videos on my channel. If you just search El Paso Manual Physical Therapy spondylolisthesis, you'll find some helpful videos to begin to get your abs stronger to fix that problem, so that you can do the knee, the tailgate swings, the knee exercises much more comfortably. Kimberly, hey Kimberly, she says, I like the tailgate swings. My hardware seems to be noisy when I do that. Is that normal? It is common to get noise from hardware. By hardware, you know, a joint replacement, the parts that make up the joint replacement, they might click and touch whenever you're moving. That does happen. As long as it's not causing any pain or discomfort, I think it's okay. And even if you don't have a joint replacement and you're getting some popping or clicking in your knee or some other joint nearby, I think it's okay for you to proceed as long as it's not causing any pain or discomfort. Again, it goes back to tolerance. If you do have pain or discomfort with popping that happens while doing tailgate swinging, then what I think at that point is that you're flared up right now, meaning you're beyond your tolerance of what the joint can take, what the cartilage can take. And so you should rest right now. You shouldn't be doing anything too active. And too active is relative. For your level right now, if you're getting pain and discomfort with popping and clicking, you're relatively flared up. You're relatively so flared up that even just tailgate swinging is beyond your tolerance right now. And you got to rest. You got to kick your feet up and relax and let it calm down, and then try again later on and see if you can tolerate it. Hope that helps you, Kimberly. This person says, can you do those standing up? I don't have any chairs high enough. I guess you could. Yeah, I've had this question before. You could do this standing. You would have to do one leg at a time. We can show on the side camera here. You'd have to find somewhere to balance and just swing a leg back and forth, just like so. I have had people do this. It's not ideal because you're balancing, you're putting more pressure on this leg. Obviously, you want to take pressure off both legs, and it just feels way more natural to sit down and swing like this. My advice would be to put something under you. Most people have pillows, cushions. I had somebody that took, you know, you got your couch. If you have a couch at home, take one of the cushions from your love seat off and stack it on the other cushion and hop up on there, so it's going to be higher up. Get some pillows from your bedroom. Get pillows. If you have pillows in your living room somewhere, you can work it out to where you've lifted yourself up and you can do tailgate swings. And I know it's going to inconvenience you and mess up your cushion situation and your pillow situation at home, but I'd rather you go through that for a short time while you fix your knee and get it healthier so that you can tolerate other exercises. Because what I need to make sure you guys know here is tailgate swings are just for when you're starting. When, you know, we have the knee arthritis recovery program phases chart here. And tailgate swings are in phase 1 here. This is when it's really severe. Once you are healthy enough to get into phase 2 and beyond, tailgate swings are no longer necessary. Sometimes people do them, but they're not critical to improving. So just keep in mind that tailgate swings aren't going to fix the whole problem. The exercises that you're doing here aren't going to solve knee arthritis. You have to progress through exercises. It's a process to fix knee cartilage problems like knee osteoarthritis, chondromalacia patella, and meniscus tears. And the chart, the phases chart, looks similar for the meniscus program and the patella pain program as well. Good question. Carmen says, what do you think of bouncing gently on the trampoline? Not my favorite because it's very quad dominant. You're using your quads and then you're also putting impact through your joint. So it's kind of a double whammy in that you're tightening your quads in order to perform the jump. Unless you're very, very, very good at using your glutes and you can confidently say that your glutes got most tired during the trampoline jumping, then I would say maybe it's okay for you, but my suspicion is that 99% of people with cartilage injuries in their knees are not going to benefit from trampoline jumping. There was a study, maybe 2 studies in it. There was very few studies, at least one that came out, and I think it was a very biased study. I think maybe a trampoline company did it. I'm not sure who funded the study, but they showed that trampoline bouncing improved knee arthritis. Very poor research, not a lot of research, maybe one study. I can't confidently tell you there wasn't more than one study. But I have had many people tell me they tried it and that it didn't work out for them. And when I think of it mechanically, the way that I like to explain things, it's so quad dominant. So you're just putting a lot of pressure through that knee joint, and it is not unloading, it's adding load to the knee. So I just think it's a bad idea in general. I would stay away from it. Hope that helps you out, Carmen. Audrey says, I have a medial meniscus tear. I had injection in it 10 days ago. Is it okay to do the leg swings? Thank you from the UK. Yeah, it's generally okay. If you had an injection, like a cortisone shot, or even if it was like a stem cells, PRP injection, or a hyaluronic acid injection, virtually any injection, you should be able to move just fine within a day or two after the shot, unless the doctor gives you some other instructions. Usually they'll just give you 2 to 3 days of rest, sometimes even just 1 or 2 days. But once you feel confident to move, you should be fine to go. Richard says, unfortunately, my meniscus tore. I was living with stage 4 osteoarthritis for 5 years without pain. Now I am facing a total knee replacement, a TKR. I'm so sorry, Richard. Maybe not. You never know. We have people in our knee arthritis recovery program with stage 4 osteoarthritis and a torn meniscus get better all the way to where they feel fantastic and they're able to avoid surgery, cancel their surgery. Some are signed up for surgery already and they end up canceling it. And they're back to hiking, being active, doing what they would love to do, even though it's stage 4. If you can fix the imbalances, then you can take pressure off the knee, off the meniscus, allow that cartilage to heal. And even though your X-ray or your MRI shows that you have stage 4 osteoarthritis, you could still improve enough to get through our phases, which are not the same as the stages. I want to highlight that. So I talk about the phases of knee arthritis healing in this chart. They're not the same as the stages of osteoarthritis that your doctor's giving you when they look at your X-ray or MRI. They're looking at how severe the cartilage is damaged. It relates more to this. So I have this model here, and you can see that. So on this side, you have a healthy knee. You can see the cartilage there looks nice and like that light blue grayish color. That's probably a better angle right there. There's no damage to it. And then when you move to the next one, it looks like there's some red right there. The edges of the bone start to get a little more lumpy. You get bone spurs. This would be like early arthritis, like stage 1, stage 2. Notice I said stage, not phase. Phase is what my program has. Stage is what the doctors are talking about. They're talking about the Kellgren-Lawrence scale. Here you have a lot more red. You can see even red on the back of the cartilage. The red means that the cartilage is worn out. And then here's the worst one. You can see all the lumps on the side. Those are all the bone spurs that develop. This would be stage 4 arthritis. Now, even if you're here in stage 4, this is what I tell people in our program, because your X-ray might look something like this, where it looks terrible. It's bone on bone. The doctor's saying you should have had surgery, years ago to replace that joint. Here's my thinking on it. If you didn't have a lot of pain, even if you do have some pain right now, but if your knee can fully straighten out and it can fully bend, it's a functional joint, even though it doesn't look great on the X-ray. That to me is like, you can have a car that's rusty and beat up and dented and it looks old. You can tell it's old. It's an older model, but it runs. It gets you from here to there. I have a neighbor down the street who drives a 1970-something Chevy, and it looks like it's not going to run, but every morning he starts it up. It takes him a minute. He starts it up, and he goes out all day long. I don't see him until the evening, and he comes back and parks. The locks don't work. The upholstery's falling apart. It looks like an old vehicle. He hasn't, kept it up. It's not shiny like some of those people that restore vehicles. It doesn't look great. It looks like this knee right here. I have people in our program who have MRIs and X-rays whose knees look like this, but we tell them, if you can bend it and straighten it, you got a shot. Let's try the program. Go try phase 1 for free on our website. It's free. You don't have to log in. You don't need to pay anything. And if you improve, then you're probably going to do very well in the program, joining the program. So that's what I have to say to you, Richard. You need to go try this out, see if you can avoid that knee replacement. Hey guys, I want to let you know that our helpline is open. Check out our phone number for the helpline. I want to answer your call. It's 915-200-4159. If you can give us a call, I'd love to take your call. Even if you're in the UK, if you're okay with being able to, there's going to be fees applied, obviously, but we can take the call. We talk to people all over the world through our programs as well, Australians as well. All right, guys, let's get back over here. Let's keep going through the best 3 exercise tips to repair knee cartilage. Let's get to number 2. Number 2, this is what I would do. Bridges. And I'm going to show you how to do the bridge. With bridges, we're doing less high repetitions, a little more resistance, but you do have to stick to your tolerance. And just keep in mind with bridges, it's a glute exercise, and you have to maintain the glutes working throughout the exercise. Otherwise, you're not doing it right, and you're going to make yourself worse. You just clear the table here so I can show you what to do with the bridge. All right, so for the bridge, you're going to lie down on your back. Your knees are going to be bent like so. And then what you have to do is press your back down. So I'm going to put my hand under my back here, and I'm pressing my low back, my lowest part of my low back right above my tailbone. I'm pressing that into my hand here. And the hand doesn't have to stay there all the time. That's just there to give you some feedback. Once you feel like you're doing it properly, flattening out your back, you should feel your abs working a bit, then you'll need your hand there. So the idea with that is get your abs, especially your lower abs, to tighten up a little bit. That's step 1. Step 2 is now to tighten up your glutes, to make these muscles purposefully flexed, tight, like they're firm. Once you do that, then you're ready to actually lift. And you can only lift if your glutes are working. If you feel like it's more thigh muscles, whether it's the front or the back of the thighs, or a sneaky one is the back. Sometimes people's back muscles start to get involved too. Then you should not be lifting, and you should just stay down thinking about pushing your back flat and tightening your buns back here. But if you can effectively tighten your buns, then what you should do is lift just an inch at first, hang out there for 10 seconds. After 10 seconds, you can come down and rest. And what you want to do is find how high you can lift your hips from the surface that you're on before other muscles start to activate. Because the mistake people make all the time is they will not think about everything that I told you as far as flattening the back to engage the abs and purposefully tightening the glutes. They'll just go up. And healthcare professionals will let you do this. They'll say, oh, you're here for knee arthritis, or you're here for meniscus tear. Let's do some bridges. They'll give this exercise out all the time, but they won't exactly tell you what muscles to fire. They'll just say, pick up your hips. And so then you guys as patients are following instructions. You're going down to the table in the physical therapy clinic, and you're just saying, all right, you said to go up and down. We're doing bridges. And after you finish all the reps they have you do, it's been back muscles working, or it's been hamstrings working, and very little glutes. And as a result of that, you're actually not fixing the imbalance. You're making it worse because you're missing using the glutes and instead using other muscles. This is why sometimes people go through physical therapy for knee cartilage problems and then end up saying, actually, my knee's worse now because you worked out the wrong muscle unintentionally. And what you have to keep in mind is that physical therapists, physiotherapists, for anyone outside the US, they are not great at helping people avoid surgeries like joint replacements. They're excellent, though, at helping people recover from joint replacement surgery after the fact. They can help with that all day. They're great at that. If you have a surgery, you should go to physical therapy, and they're probably going to do a fantastic job for you. But if you're trying to avoid having surgery for a knee cartilage problem, they're going to do the best they can, but they're just not taught in school what I'm teaching you here. It's not super hard. It's just not researched very well yet, so it's not supported. But you guys are here, so let's do this correctly. So just to review this again, you're flattening out your back, tightening up your buns, then picking up as much as you comfortably can, and stop if you feel like you're using other muscles and that you're hanging out there for a 10 count. And the 10 count's really important so that you make sure that you continue to think about tightening your buns back here and make the buns, the glutes, the butt muscles, the most tired muscle of all when you're doing this exercise. It should feel like you're getting a workout back here. And then you're going to repeat this. What I start people out with is 10-second holds 10 times. That's usually a good starting point. And it's okay if you can't do it yet. If you only do 7 reps or 3 reps, or if you can't hold for the full 10 seconds, you can only hold for 5 or whatever time less than 10 seconds. Work with what you got. Remember, we're staying within our tolerance. It's a big deal. And do what you can. And if you feel like you get halfway through the reps or some midpoint, you're not at 10-second holds, 10 reps yet, and you stop using your glutes and you feel more thigh muscles working, you should stop, because what's happened at this point is you have exhausted what your glutes can do, and now you're compensating with other muscles. And if you just proceed in order to get all the reps in order to meet the goal of 10-second holds, 10 reps, but you stop using your glutes at rep 7 or rep 8, then you're actually making the problem worse. You're doing it wrong. So you need to have the maturity, the patience, the awareness to stop when you don't feel the right muscles working anymore. And that leads me to my next principle. Let me write that up here for you guys. This is the last of the 4 principles. I'm going to get started on this real soon here as well. It is patience. And let me explain that just a bit more, because, you know, I just mentioned on how you have to have the awareness, the maturity. I say maturity because I feel like some people are just like, I'm going to do this, no pain, no gain. And that is a wrong approach. No pain, no gain works if you're healthy. If you don't have any knee problems or any body problems, your body's ability to move forward in an exercise is not limited by a joint problem or any sort of muscular problem, musculoskeletal problem. If it's just limited by your mental ability, like you don't think you can run that far or lift that much weight, then no pain, no gain applies. But if you're recovering from a knee cartilage injury, you need to listen to that pain. It is your body communicating to you. That's all the tolerance we have. And so you have to practice patience to say, I'm going to have to stop at rep 7. He said to do this every hour while I'm awake, and I had to stop at 2 o'clock because that's all I got right now. It'll get better later, but you have to have the patience to say, not yet. And another aspect of patience that you guys probably get from the medical field is, let's say you have a knee injury, you go to the doctor and they determine that you have a cartilage problem. You get your X-ray or your MRI, and they tell you it's bone on bone in your knee, or your meniscus is torn, or we can see the cartilage between your kneecap and your thigh bone is showing you have chondromalacia patella. They do that X-ray where your knee's bent like this, and you're looking at it from this angle, and you can see how, if the kneecap is touching the bone on the thigh bone or not. And then what the doctor says next is very important. They'll say, let's try this for the next month or 2. And it might be a pain medication that you take by mouth. It might be an injection. It might be physical therapy. They do some treatment, whatever it is. Doesn't matter the treatment at this point. But what they say to you is, let's try this, and then a time frame, a month, 4 weeks, 8 weeks, 3 weeks. And then what they say is, come back and let's see how it worked. And what they're doing to you in that moment is giving you a deadline. And they're saying, you have 1 month to make physical therapy work. You have 1 month to see if this injection works. You have 1 month, 2 months to see if this medication works. When in reality, that injection or medication is never going to fix the muscle imbalance. It's never going to heal your cartilage. It's just taking away the pain. And physical therapy hopefully can fix the problem if you have the right kind of physical therapy going that's fixing the muscle imbalance, which doesn't tend to happen. They tend to be great at fixing people after surgery. Then you go for that follow-up, I'm still talking about patients. You go for the follow-up and the doctor says, oh, the pain medication helped for 2 weeks. And then after that, it didn't help anymore, huh? Let's try the next treatment. So they'll move on to the injection. Come back in a month or two. Oh, it felt better for a month. And then at the second month, it didn't feel, okay, let's try physical therapy. Oh, that worked for the first few weeks. And then your knee started getting worse. All right, we're out of options. Let's do the surgery. They put you on a timeline. They give you deadlines. And typically this process is anywhere from 3 to 6 months. And to heal cartilage, it takes a better part of a year. I mean, if we're talking about fully fixing it, like fixing the muscle imbalance, if you're just looking at tissue healing times for cartilage, a month or two is right. And that's why the doctors give you this expectation, this deadline. But if you're not fixing the muscle imbalance that got you here to begin with, and you're just relying on a medication or an injection or physical therapy that doesn't specialize in avoiding surgery, then you're not doing the right treatment, and you can't expect this to heal in a month or two. When we put people through our programs, like our knee arthritis recovery program, we tell them it's going to be the better part of a year, maybe a year, maybe a little bit more than a year. On average, it's like 9 to 12 months. So you have to have patience and disconnect from the timelines that the medical field generally gives people. And what you have to focus on is, are you improving? Is this month better than last month? Is this week better than last week? And if it's a yes, you're doing the right thing. And it's okay if the doctor is still saying, well, you're not 100% yet. Don't worry. It's only been 2 months. And were you even doing the right thing? So big principle here, patience. So when it comes to doing tailgate swings and bridges, patience is a factor that you need to consider, and you need to hold in your head. The doctor said this long, but it's probably going to be way longer, because Dr. David's saying 9 to 12 months, in some cases 15, 16 months. Depends on how severe it is. If you've got stage 4 osteoarthritis, it might take you a year or more than a year. If you've got stage 1, stage 2 osteoarthritis, probably 6 months, maybe 9 months. So just keep that in mind. All right, do I keep going here? Let's get to some comments, guys. Hopefully that spurred on some questions, and we can help you out in the comments. We got Cynthia here, says, valuable information. Thank you, Dr. David. You're welcome, Cynthia. Glad you're benefiting from this. MR says, I'm appreciating your knee cartilage lessons very much. Great. I'm glad this is helpful for you guys. That's good feedback. Thank you for telling me. Cindy's on here again. She says, question, this may be off topic, but what about leg cramps? Feet, calves, and inner thigh. The inner thigh cramps will make you want to die. Oh, no, I'm so sorry, Cindy. That's not fun. Cramps happen usually as a result of muscle weakness. And it could be muscle weakness because the muscle's just been underused for a long time and you're making it work. Like in the example of foot cramps, that's a common one. I tell people to start doing toe curls as part of my rehab program, my treatment approach for fixing knee problems, because foot strength is really important to help the knees. And if you haven't done foot exercises in a really long time or ever, usually the first time you go to maximally curl your toes, you get a cramp. And that's just your foot muscle saying, I am not ready for that. My tolerance isn't there yet. So you have to work at the tolerance you can do before it cramps. So the way that I say that to people is I'll say, if you did 100% toe curl, 100% on an exercise, and it cramped on you, back off. Do 80% or 50% or even 10%. Do what you can to make the muscle work within its tolerance. And if you keep going like that, the muscle responds. It'll get better and better. And then eventually you'll be able to take 100%. Now that's one reason to cramp. Another one is if the muscle's been overused for a long time. So my suspicion is with the inner thigh muscles, those inner thigh muscles, the groin muscles, can compensate for weak glutes. They act with the quads very often on the front of the thigh, and those inner thigh muscles, because the opposite muscle is the glutes on the outside. If your glutes are very weak, your inner thigh muscles tend to take over in order to give your body stability and balance. And if they're used to doing that for a long time, and they're overused, they might cramp on you when you ask too much of them. And it does go back to a tolerance issue there as well. Bottom line here, Cynthia, is you probably need better glute strength, better abdominal strength. You need to start fixing the muscle imbalance, essentially, which we talk about in our programs. And that tends to make the cramping go away gradually. The thing that I'm saying here the thing that I'm not saying that you all are probably thinking about is electrolytes. And here's the thing. If you have a halfway decent diet, you eat some food, maybe it's healthy, maybe it's not, a mix of both, and you're hydrated, you probably get enough electrolytes, and you don't need to go start taking potassium pills or eating bananas. That's very rare, because if you truly had an electrolyte deficiency that was causing cramps, you would get cramps all over your body, not just in a specific muscle. It's rare that it's a electrolyte problem. And really, you're only going to run into electrolyte problems if you've been exercising a lot. Like people that do marathons, 26 miles running, get electrolyte problems because they're sweating the whole time. So when you sweat, you lose electrolytes. That's why, people drink those electrolyte drinks like Gatorade, Powerade, vitamin water, all those, because they're trying to replenish the electrolytes. So it's rare that you need more electrolytes. People mistakenly go eat bananas, go drink all those drinks, and they don't need them. They need to actually exercise. And the third problem that could be happening is a nerve issue. That one happens, but it's a little less common. So I would go after strengthening muscles first. Hopefully that helps you out, Cindy. All right, next question. LOL, my GP gave me a leaflet on coping with knee arthritis and another about getting home help, and that was it. I've had to go private. Yes, that happens a lot. GP, those general practitioners, general physicians, this is how the medical field sees knee osteoarthritis. They think that it's an age-related problem and that it's not in your control, that you're 65 years old and it's all downhill from here is what they're thinking. And the way they think that is because they get feedback from the patients they're seeing, because most patients aren't like you guys watching here trying to do something about this. They just continue to let their bodies fall apart. They don't exercise more. They don't fix this. And if they do by chance exercise and they do have the motivation to go do something about their bodies, they're often given the wrong advice by people in the medical field, telling them to strengthen their quads, telling them to strengthen their hip flexors. They're not focusing on glutes. They maybe do some glute work, but don't make sure that they're doing the exercise correctly, like I showed you in bridges. You have to tease out the right muscle. If you can do that, which is totally possible here, then you get control back despite you aging. Because people going through our programs are getting older right now, yet they're getting better. Their knees are getting better. How is that happening? They're aging, yet they're improving. It's because we're fixing the muscle imbalance. It's because they're doing the right work. They're offloading. They're following principles here that I set up for them in our programs, and it's working for them. And age doesn't matter. You can get better even though you're getting older. So a good job on looking elsewhere, because that's what you needed to do for sure. Awesome. Cheryl says, are you involved in research studies? I'm trying, Cheryl. It is an uphill battle because the stuff that I'm talking about is I feel like I'm the black sheep of the medical community. Like, it makes sense when I get a clinician, like another doctor, physical therapist, when I explain this one-on-one to them. What very often happens, Cheryl, is they'll, if they're open to me, they'll start saying, how does this work, this muscle imbalance thing? And I'll tell them, well, these muscles are overworking, these are underworking. And then they'll say, that makes sense. I've had that problem myself. And then their head explodes and they're like, I have been telling so many patients the wrong information. I've maybe been making them worse. And then they go start telling them my information. Happens so consistently. But they've got to be in that place where they're open to doing it. And so I've had a hard time doing research. We're trying to conduct some research, basically collecting data within the people that are in our groups here. And if they're willing to do it, but it's a long going road. Hey guys, I'm told we have a call to take here. So I'm going to see who I can talk to and help over here. We got Van. Okay. Hey, Van, are you with me?
Oh, yes. Hi, how are you?
Hi, Van. I hear you're up in Boston and you got a knee problem. Is that right?
I do, yes. Condylomalacia patella of the left knee. I'm a
Oh,
soccer player, and kind of started just creeping up on me, and just couldn't play one day. So,
bummer.
been following your videos, trying to solve it. Got a lot of range of motion back,
Good.
which is very, very good. Love basically through all your advice, mostly on the glutes, the hips, hamstrings.
Fantastic.
But my physical therapist recently started me on what he calls blood flow restriction, which I've never heard of.
Yeah.
And with the cuffs and all that. And so I'm still focused on glutes, hamstring, and all that. But he started me doing the BFR with like single leg, what's that, Bulgarian split squats, things like that.
Yeah.
And I'm wondering if that's something that I should be even pursuing right now. I don't have knee pain when I walk, going up and down steps now. All that has been solved, but I still can't sprint or deaccelerate or jump. I still have the pain then. So I'm wondering if BFR is a valuable kind of method, or am I just going to be hurting myself over the next couple of weeks while I do this and kind of go backwards in my progress?
Yeah, this is a great question, Van. I haven't talked about BFR, but just for the sake of everybody watching here, because we are live, BFR stands for blood flow restriction. So they call it BFR training, blood flow restriction training. And is this what you have going on? Are they putting like a tourniquet around your upper thigh to restrict the blood flow? Is that how they're doing it with you?
Right, exactly. Then they had me go through like 30 reps with the breaks and 15 reps, 15 reps, 15 reps.
And are you doing knee extensions with the tourniquet on?
So he wanted me to try the knee extensions. I just flat out told him I don't want to do that.
Okay.
Even with like 5 pounds, it hurts without blood flow restrictions. So I was like, I don't want to do anything that really hurts me.
So you're doing a Bulgarian split squat with the tourniquet on your leg then?
Yes, and then hamstring curls, some calf raises.
Hamstring curls, calf raises.
We're going to start some hip work sometime soon with the I guess it's the abductor or adductor, whichever one where you push it outwards, I guess.
Yeah, that's AB, abductor. Got it. Okay, so the way this works, my understanding of it, and I could be wrong, but because I haven't gone through proper training on blood flow restriction training, but my understanding is that when the blood flow is restricted to a muscle, and then you exercise it, you're actually depriving it of oxygen, which stimulates muscle growth. You get the stuff inside your muscles to grow more so they can take this. And so the idea is you're trying to kind of shortcut strength training. However, what I always ask the question of, is this helping the muscle imbalance or hurting the muscle imbalance? And because they're putting the tourniquet on your upper thigh, it's hard to really cut blood flow off to the glutes, which I'm most concerned about. So as a result, if you're doing Bulgarian split squats, calf raises, all that, it might be making your quads overwork. Now, the best feedback that you're going to have to go over, Van, is what muscles are burning most when you're doing the blood flow restriction training. What do you think?
Yeah, so I would say when I'm doing the Bulgarian, I do feel it a decent amount in my glutes, but I also do feel my quads burning, which I know there's probably going to be some of that, but we obviously want to try and avoid, working the calf or working the quads too much. In this stage. So I do feel glutes, but I also feel quads, which I don't want to right now, obviously, with how your advice and has helped me recover.
Yeah, that's my concern is, and see, this is how most physical therapists approach the situation. They'll say, let's strengthen everything. And so they're going to be happy that you're strengthening your glutes. Like they're physical therapists are never trying to not make you get stronger glutes. In other words, they want you to get stronger glutes, but they also want you to get stronger quads and stronger hamstrings and stronger calves. They want all the muscles to get strong. And that's where I differ, because I'm like, we don't need to touch quads right now or hamstrings. If you have chondromalacia patella, as in your case, man, we need stronger glutes, and you need to make sure you know how to use them. Quads and hamstrings will catch up, but first let's get the glutes going, and let's get the pain completely gone, under control, before we get anything going in the quads or the hamstrings, like intentionally. So I based on what you're saying here, I would disagree with doing the blood flow restriction training at this time. You got to navigate that, though. You got to see what's best with your therapist, and they're seeing you in person, so they have that leg up on me and that maybe they see something that I don't. And so you're going to have to kind of talk through things with them and think this problem through for yourself. Just keep in mind, you're always your best advocate for yourself. But, you got to put together this information that I'm giving you along with what they're doing with you.
Right. That makes sense. I appreciate that. That was kind of where I was headed with that as well. It's, if there's pain, if there's something that's being targeted that hasn't helped me in the past, then I don't see a point of how, restricting blood flow to that area, then targeting it wouldn't be any better, even if it's less load or whatever, the main kind of process with BFR is. But thank you. I appreciate that.
Yeah, absolutely.
And in line with what I was thinking, and it's good to hear you say that too.
Yeah. Fantastic. Glad it helped. Awesome, Van. Well, thanks. I'm glad I could help you.
I appreciate it. Thank you. Thanks for all the work you do. You've helped a lot of folks, including myself, and given us a lot of hope. So I really do appreciate all the time you take to put into all these videos and advice that you give us.
Of course. Happy to help, Van. Thank you.
Take care.
You too. Bye-bye.
Bye.
Awesome question on BFR. Van had really good insight there and shared that Van is working their quads in addition to glutes. Glutes are working, but quads are also working, and so that's a concern of mine with it. When it comes to chondromalacia patella, is we don't want to. We're not trying to make the quads weaker per se. We're trying to just get the glutes stronger. So if you think of it in terms of like a bar graph, if your quads are very dominant, your glutes are very weak, that's what leads to chondromalacia patella and meniscus tears and knee osteoarthritis. I don't necessarily want to bring your quads down. I'm fine with them staying there, but we need to bring the glutes up. But if you're working out both muscle groups, and you're just going to be in an imbalance, and you could be very, very strong, but still very imbalanced and still have a lot of knee pain. And that's my concern that I see with people that are strengthening everything generally. Now, with the blood flow restriction training, my view on it, this is just my opinion, is it's a bit of a trend, a fad. But what you have to realize is that in the medical field, trends and fads are not like fashion trends and fads where they kind of come and go within a decade. Like there was bell-bottom jeans in the 70s, and the 90s had its own trends with hairstyles and shoulder pads for the women in their dress. And, men have their own fashion trends as well. But in the medical field, trends stay around for many decades. And I think that BFR is one of those. It's been around since I think the mid 2000s. At least that's when I caught wind of it. And it's still around. It's growing. In fact, another one is dry needling. And I want to say clearly that maybe they help with pain. They might help with pain. But are they fixing the root problem? That's where I have to ask the questions of, is this going to be beneficial for you or not? Because somebody doing dry needling, for instance, might say, I feel so much better. I was able to sleep at night. I could move better. I had better range of motion. Great. That's all helpful to do exercises that are going to fix the root problem. We still need to come back to this. And this is where I hang out, is I'm not against dry needling or against BFR. It might be useful in certain situations at the right time. Massage is one of those, or using heat or cold. There's all kinds of treatments out there, but we have to think of the process of fixing a knee problem and when it's right to use each treatment. You can't just rely on lasers to fix your knee arthritis. You can't rely on shockwave to fix your meniscus tear. It's got to be using the lasers or the shockwave or an injection of some sort at a certain time to reduce pain a bit. It's not fixing the root problem, though, so that we can get to the right exercises to then fix the mechanical forces going through the joint, which long-term is what's healing you and keeping you from having surgery. So that's my opinion about BFR training. I'm not against it. We have to think about it strategically and critically to make sure that we know when it's the right time to use it and when it's the right time to back off or not use it. It's just a matter of thinking about it. All right, so before we get to the final exercise here, let's talk about through ways to make knee cartilage problems worse. Because if we know that, then we can know what to avoid, and we can. It's kind of looking at the other side of the coin of what's the opposite of what you would do. So, number one here, way to make it worse would be to do, if you have an active knee cartilage problem, is to do exercises with heavy resistance. I'm just going to write resistance like that. And so think about it. If you have a meniscus tear or chondromalacia patella like Van, or you have knee osteoarthritis, and if I were to say, all right, we're going to do weighted squats and we're going to add more weight and do more of them, it goes back to doing the no pain, no gain situation with an active knee cartilage injury. You're going to worsen it because keep in mind, cartilage is designed to absorb forces to cushion the joint as it moves and takes on loads. But if it's not currently healthy enough because it's been torn, it's been injured, it's irritated, whatever the case may be, it needs time to heal. And so you have to reduce the forces going through it, not add more forces. This is why I'm a big advocate of offloading if it's really bad. So like if you can't walk without pain, if you can't put your body weight through your knee joint without it hurting, that means that just normal standing and walking is currently beyond the tolerance of the cartilage in your knee. And you have to take weight off. Using crutches or a walker or a cane will help that. So if you want to make it worse, add a lot of resistance. Go do heavy resistance, lift weights. That's going to make it worse. The second thing that's going to make it worse is to rest indefinitely. Definitely. What that means is I've had patients in the past that have been told by their doctor to stop doing things. You got a knee injury, get off your feet, put ice on it, take this pain medication. Let's just rest for now. And then that's it. The doctors end their sentence. And what that leaves the patient thinking is, I shouldn't do it. I shouldn't be walking. I shouldn't be. And so they'll cut down their activity level to an absolute minimum, just going to the bathroom. They get help with cooking and cleaning and stuff. And they have nice family members that take good care of them. And then they end up feeling worse later on. And the reason why this is such a bad way to make your knee cartilage worse is because cartilage needs stimulation. It needs movement. You need to move the joint. You need to circulate the fluid in there. If you have your knee still, if you're just resting your leg up on a pillow in bed or on a recliner in front of the TV just to rest your knee joint, and you're doing this for days and weeks on end, it actually tells the cartilage you're not needed. We can atrophy. We can weaken in the area. That's not good. We need some stimulation. That's why I'm a big proponent of tailgate swings, because it tells your cartilage we're moving. We're getting things moving here. We're getting you some nutrition. We're taking the bad stuff out. We're preparing to do heavier stuff. Let's get moving here. But if you just rest, just like if you do nothing for weeks or months, your muscles go away. Your muscles shrink and atrophy. So will your cartilage. So you can't just rest indefinitely. You have to do what's called relative rest, meaning do what you can within your tolerance. Do high repetitions, low resistance movements within your tolerance, and be patient. Tailgate swings is an excellent place to start. This is going to absolutely not help you in the long term. It might feel good for a few days, and that might be all you need, but you need to eventually get to some movement. It's just that most doctors, most GPs especially, they're not thinking in terms of mechanics of the joint. That's my job. They're thinking of just helping you with pain and inflammation. So they give you anti-inflammatories and painkillers and give you general advice to get that pain down. They're not going to know for you to do tailgate swings or to start turning on your glutes in a bridge exercise. So that's number 2 there. Let's do number 3 here. The number 3 way to worsen your knee cartilage is to overdo it. Overdo it. So heavy resistance is one way to overdo it. Another way, because you might be doing something that's easy, it's just basically to go beyond your tolerance. Like let's say walking actually feels okay. You have a known cartilage injury, like you have knee arthritis or a meniscus tear, and you can walk for 15, 20 minutes, maybe longer. But then you decide to go on a long walk. The holidays come around, or the sun's coming, springtime's coming up, and you've been indoors in the snow or in the cold weather all day for weeks on end, and now you want to get out now that it's warming up a bit. And so you go on a hike, you go on a walk around the park, you go shopping, you go do something more active, and you overdo it. You're doing too many repetitions, because even though I said high repetitions here, you have to keep in mind that it's high repetitions with low resistance within your tolerance. I said to do tailgate swings every hour for 5 minutes. But if you're doing 10 minutes every hour, and by 4 o'clock in the afternoon, you're hurting, and you keep going, now you're overdoing it. So don't overdo it, guys. All right, guys, we have another call on weight. We got Jacqueline from California with some knee pain. Let's help out Jacqueline. Hey, Jacqueline, are you there? This is Dr. David.
Hello there, Dr. David. Yes, I'm here. How are you?
Hi, Jacqueline. I'm doing fantastic. It's so great to talk to you. How can I help you?
Well, I just wanted to first let you know that the glute presses that I've been doing of the legs have really helped my my hip arthritis.
Oh,
I've got a
fantastic.
surgeon that's been waiting for me to do a surgery for like 10 years now. But I
Wow.
came across your show, and it's amazing. Thank you so much.
Oh, absolutely. I'm so glad you're benefiting and getting better. That's great to hear.
Oh,
Well,
yeah. The hip itself hurts very rarely, and then I can just massage it out, But the problem I'm having is it's either a muscle or a tendon that's coming in from the back of my inner knee.
Okay.
On the right, it's my right leg that I'm dealing with, and it comes up. It feels very thin. I don't know whether it's a tendon or a muscle.
Okay.
But it comes in. It starts at the bottom, right in the crease of my knee, and it comes up and across and lands in my groin.
Okay.
What is that, and can you help me with that?
When do you feel it? When does it come on? Is it all the time with a certain movement, or just like at the end of the day if you're more active? Can you tell me more about that?
Usually, lately, I'll be okay until I go shopping, and I go to 2 or 3 different stores. Lifting my leg up out of the car and putting it back in becomes a problem, and then when I get home for a couple of days, I'll have this tendon or muscle problem.
Got it. So that usually means that, when you go out shopping, you're probably a bit more active, you're moving around a bit more. You're likely using that groin muscle, that muscle that goes from your knee up your thigh, a bit more than you normally would on a day that you're not as active. That tells me that your glutes need to get even stronger so that you can consistently rely on them on those more challenging days for you. Does that make sense?
Do you think that working with the glutes will help to alleviate that groin pain?
Oh, 1,000%.
It started with the groin, and then it went over, then the pain went over to my hip, but the doctor said that my hip was jacked up already.
Yeah, I don't know. I always wonder about that when they look at an X-ray and how can they know which one happened first? It's unless they have more information than that. But what happens? I don't know if you could see me on the video, but you have your inner thigh muscles, your groin muscles. I'm talking about the same thing. They start at your inner knee and they run up the inner thigh, and they attach to the pelvis bones, like in the groin area. And those muscles are opposed. In other words, the opposite working muscles are on the outside of the hip, which is the glutes. So if you have weak glutes, then not only will your quads in the front of your thigh compensate or work extra to take over, but also the inner thigh muscles can do that as well. And if you're more active, like you're getting out of the car a lot, you're shopping, you're potentially carrying, items that you shopped with around, you're pushing the shopping cart, you're just moving more, then your glutes kind of run out of energy, they run out of gas, and then other muscles say, all right, well, glutes aren't going to help. They're done. That's all they got for today. Come on, groin muscles, you got to do this because we're getting through this day. We're going to keep going. So that's why it'll start to hurt. And it can feel like it shifts because a tendon might move around over another tendon behind the knee. Sometimes the nerve can also be an issue in the area. You have the obturator nerve, you have the saphenous nerve that runs in the area too. But I would go back to getting stronger glutes so that your inner thigh muscles aren't working extra. I think that's what it comes back down to.
Thank you so much.
Yeah, absolutely. Does that make sense?
Yes,
does. And I just want to tell you that every time I see your face, on a post that comes through, YouTube, I automatically just start, pulsing my butt.
You get the glutes work. I'm a reminder to you to get those exercises in, right?
And I'm like, oh, here I go. Let's do it.
Good. I love it. That's what needs to happen. You need to get these glutes stronger so that we can avoid surgery forever. I want you to have your last days on earth having fun, having a blast, not in the hospital or dealing with health issues because of your hip. I want you to be dancing and shopping all you want and doing fun stuff. So let's get those glutes going. I love it.
Oh, thank you so much, Dr. David.
Yep.
You are such a blessing.
You're welcome. Absolutely. Have a wonderful day. Thank you.
You too. Thank you. Bye-bye.
Bye-bye. I love it. That's great. So the highlight of that call, or the main point is, I talk about the quads on the front of the thigh. They attach to the kneecap right here. These muscles right here being the main culprit of the muscle imbalance. And they're putting a lot of pressure on the kneecap and the rest of the knee joint. But up in the hip, those quad muscles can also affect the hip and cause hip arthritis, hip labrum tears, bursitis, tendonitis up in the hip. But you also have muscles that connect down here on the inside of the knee and they run up into the groin area. And those can also be overused because of weak glutes. So those muscles in the medical field are called the adductor muscles, ADDUCTOR muscles. And the muscles that oppose them, because you always have muscles that oppose each other. That way you can finish off the motion either way. Like in the elbow, you have the bicep that bends the elbow, and then you have the tricep on the back of the arm that extends the elbow, and they work together to make your elbow move. In your hip and your knee, you have the groin muscles that bring your leg inwards, and they help with rotation as well. And then you have the glute muscles that oppose them to help move your leg outwards and backwards, and they also help with the rotation as well. So the use of your glutes, increasing your glute strength, increasing your glute endurance, and being conscious of using your glutes as you go through your day should decrease use of your groin muscles so that you don't get discomfort in your groin and the inner thigh muscles. All right, let's get into some comments here next before we wrap this up with the last exercise. So Cynthia says, I have used magnesium oil spray successfully on muscle cramps. Those inner thigh ones are a killer. Yeah, cramps anywhere are just no fun. But yeah, I'm glad that you found something that worked for you. Great. Up next, we have Grace here. She says, my legs are a bit weak due to lack of immobility because of my osteoarthritis in my hip and now knees. How can I strengthen my legs? Well, the good news is when you're starting out with, if you have a lot of immobility, just tightening the muscle. I mean, like right now standing, I can tighten my glutes and I'm not really moving a whole lot. I'm not bending my hips or my knees. Just tightening the muscle is an excellent first exercise to do. Like we did it on the bridges. I got in the bridge position on my back with my knees bent. And before I lifted my hips to do a full bridge motion, I just tightened my glutes. That's a big starting point for a lot of you guys. And it's kind of, I don't know what the word is. I guess it makes people feel like they're not doing much because they're not exercising per se. Like you're not doing some big movement that somebody else would be able to tell that you're doing an exercise. You're just sitting there or standing there and tightening your glutes. But that's what a lot of people just need at the beginning. They just need to turn on their glutes, because if you go do that big movement, you might be using different muscles. So I'm a big fan of just activate the glutes. I think that'll help you out here, Grace. And oftentimes people just turning on their glutes brings the pain down, and it might get you back some more mobility. Start with that. I just want to remind you guys, we have phase 1 of our hip arthritis recovery program and our knee arthritis recovery program available on our website free. You don't have to log in. It's just there. There's a website right there. You go to that website, you'll see if you want to do the hip program or the knee program, and you can start now for free. No login required. You don't have to give us your email address. You don't have to pay a dime or a penny or nothing. You can just start watching the videos, and one of the exercises that I talk about in there are just activating your glutes. So I give you a lot more details and demonstration, as well as all the rest of the stuff from phase 1 of our hip arthritis and knee arthritis program. So go check it out on our website right here. I'd love for you guys to get that help for free. Next comment here is from Cheryl. She says, what patient have you seen that you agree would best benefit from a total knee replacement? What profile of a patient? The number one thing, Cheryl, the number one thing, Cheryl, is a consistent loss of motion in the joint. So if we're talking about the knee, it's the same in the hip though. If you cannot fully straighten out your knee, if your knee's bent like this and you try and it just doesn't go, and it's been months, it's been like 2 or 3 months like this, and you cannot fully straighten it out, that's a big problem because you have to be able to straighten out your knee to stand and walk on it. And if you can't bend your knee within the like 80-90% of the full range of motion, that's a problem too. You need to be able to bend your knee to get in and out of cars and chairs, the shower. You got to be able to bend your knee to get your leg over the wall of the tub, to go up and down steps and curbs. So you need to be able to bend your knee a decent amount. Now you could have a 10-20% loss of motion and still get by, but if you have a 40-50% loss of motion, I tell people at that point you might need to talk to the surgeon and see about replacing the joint to see if you can get that motion back. But even then, we do have people that have some big losses of motion and they go do our phase 1 for free on our website and get improvements, because the main thing that's stopping them from bending all the way is all the swelling and the compression from the muscle imbalance. So if they start to fix that with phase 1 of our program and they get more motion, then I tell them, oh, it's on. You don't need to go to get a surgery if you're already improving going through phase 1 of our program. Keep going through the program. Now you might want to join our program to get the rest of the program and get all the other benefits that come with it, like our weekly group coaching calls where I'm teaching, my team's teaching. We have office hours going on. Like we're starting to introduce office hours. We're always adding things to our programs, by the way, and trying to improve the value of it and getting people the result of avoiding a joint replacement and getting back to being active and healthy again. So I would say it's that would be the number one thing. Now, weight beyond a certain level, which I've talked about, that BMI greater than 35, that could be another factor. But even then, I would say let's get that weight down. Let's get that BMI number better, and you'll probably be fine not having surgery. Because even if you had a high weight, the surgeon might tell you we can't do the operation. So that's kind of a separate factor. So I hope that helps you out there, Cheryl. All right, we got another caller here. We got Richard in Connecticut with a knee problem. Let's help out Richard. Now, let me get a swig of water real quick. So I don't make frog noises on you guys. Hey, Richard, are you there? This is Dr. David. Hey, Richard, are you there? Oh, it sounds kind of choppy. Richard, I'm getting a choppy signal from you.
Yeah, I am.
Oh, there you are. Okay, I can hear you better now.
Can you hear me?
Oh, there's a big delay.
I'm here. You can't hear me.
Hey, Richard, try muting your computer so that you don't get feedback.
Can you hear me okay?
I can. I think there's a delay, though. Can you hear me?
Maybe it's better over here.
Richard,
Hello?
I'm here. Richard, let's try it out. Richard, if not, I'll call you right back. But let's try this out. So how can I help you? Yeah, I think there's a big delay. All right, Richard, I'm gonna try hanging up here and calling you right back. I got your number here. Oh, no, there it is.
Your call has been forwarded to an automatic voice message system. 890-432.
See if we can make this connection here. Come on, Richard.
Okay, let's try this again.
All right, I think that's better, Richard. I think I got you. Can you hear me?
Yes, perfect.
All right. Glad we fixed that glitch there. Well, welcome, Richard. It's Dr. David. How can I help you?
Yeah, there's a huge different issues going on. The first one you addressed before was my left knee. I'm up for a total knee replacement.
Oh.
I did do your phase 1 program.
Oh, great.
I wasn't able to type all this, and unfortunately, I'm still left with a knee that doesn't want to bend. So I pretty much accept it, unfortunately.
Mm-hmm.
My right knee is perfect, except for one issue. Is hold on, I wrote down the name. It's a nerve irritation.
Is the saphenous?
Some kind of entrapment. Yes.
Yeah.
It happens when I bend my knee at 45 degrees and move my right knee to the left.
Uh-huh.
Then the nerves overreact, and it happens too when I sleep. So if I don't use a knee pillow,
Oh, geez.
then I'll get extreme pain from the nerve.
Yeah.
And it's just kind of irritating. I'm wondering if there's anything to do to improve that.
Got it.
I mean, the knee pillow works great, by the way.
Okay, good.
It stops it from moving, and I'm able to sleep for the night.
Yeah.
And it's mostly a non-issue during the day. I don't even notice, but I kind of like to fix it.
Yeah, absolutely. Let me just clarify. So you said it's your right knee when you move it to the left. That's when the nerve bothers you.
Yeah, if I bend it 45 degrees.
Bend it 45 degrees and move it to the left. Got it. Okay.
Yeah.
And it's your left knee that has the bending issue. Is that right?
Yes. Yeah.
Okay. So your right knee, the one that has the nerve problem, bends and straightens all the way.
Oh yeah, it's perfect.
Okay.
I just wish my left was like that.
Got it. So then tell me a little bit more about how your glutes are activating. Do you think that you've got good control over your glutes at least on the right side?
I do. I do the glute exercises. I do the bridges often.
Yeah.
I'm definitely good control of the glutes.
Awesome. Fantastic. Now, do you feel that the nerve problem gets worse as the day goes on, or is it just when you do that movement, when you bend it 45 degrees and then move it to the left?
No, it's just when I do that movement.
Got it. Got it. Any nerve issues that you suspect on your left knee, the one that can't bend as well?
Now that you mention it, I did notice that I have that same nerve issue on the left knee.
Okay. And does it just hurt at the knee? The nerve issue just hurts at the knee, or does it go into your thigh or into your hip, or does it go down below the knee, like calf or foot area?
No, it's just in the upper left area of the right knee.
Okay. Do me a favor. Are you able to reproduce this pain right now? Like if you were to sit down and bend your knee 45 degrees and move it to the left, do you think you could make it happen?
Yeah, sure.
Okay. Well, I know it's gonna bother you, but here's the thing. I want to just do a little test on you to see if it's truly a nerve problem or maybe it's something else.
Okay.
If you can just sit somewhere comfortably, and I don't want you to force a lot of pain. I just want you to be able to get to the edge of where it starts to bother you and then back off.
Sure.
Okay. I just want to make sure that you're not, worse off today. So if you can sit comfortably and then go ahead and reproduce it so you kind of know where it starts. Tell me when you've done it.
It doesn't start right away. It's like probably 30 degrees
from the middle?
From baseline. Yeah.
Okay. Got it. Okay. Now, what I want you to do now is look down with your head and bring your chin to your chest and slouch down pretty much as you can. Like you're bringing your head towards your knees. I don't know if you could see me on the video, but I'm doing the same motion that I'm asking you to do.
Okay. Yeah.
And then do the same thing with your leg to reproduce the pain. Does that make it a little more intense or less intense, or is it about the same?
Less intense.
Oh, that's interesting. That
usually it's more intense.
No, just a change in general, whether it's less or more intense, tells me that it is a nerve problem. And the only reason why I'm interested in this is because nerve problems are hard to diagnose, and I often see other healthcare professionals misdiagnose them. They miss that it's like a ligament problem or a meniscus problem in that area of the knee. But if that's the case with you, then it probably is a nerve issue. Then what I'm thinking now is you probably need more nerve mobility throughout your whole body, because what I did there by having you bring your chin down like that and slouching over is we added some tension to your spinal cord, because when you bend forward like that, it tensions the spinal cord a little bit. And if it changes the way the symptoms behave in your knee, then it tells me that it's not a ligament or a meniscus problem. It's probably there's some nerve factor to this, whether the pain in the knee got worse or better. So here's what I would want you to try. And we're not gonna be able to figure this out today. You're gonna have to go try some movements. And then if you can get back to us somehow, that'd be great. Or at least, give us some feedback. But you need to try some consistent movement. So like tailgate swings is going to be gold for you. Maybe even cycling. And what I'm trying to do here is when you do that movement, you're getting the nerve, not only the joint, but the nerve to actually move. Nerve problems tend to happen when you have overall less movement in your body. They just get kind of stuck, if you will.
Oh, I see.
Yeah. So you need to have some consistent movement. So what I want you to do is tailgate swings hourly, as long as you can tolerate them, without making this worse. Or jump on the bike 2-3 times a day. Ideally, you would have a stationary bike at home or something like that. But tailgate swings you could do anywhere. And
you have a very good point there, because this started to get more noticeable when I stopped doing cardio because of my left knee issue.
Yeah.
So I think you're onto something about the movement for sure.
Yeah, it happens. It happens to me. And if I have a long road trip or a long day of travel, like where I'm sitting most of the day, like 8+ hours a day, when I first get up to move, I feel a jolt of pain go down that same nerve. And then I have to take like 5, 6, 7 steps to get the nerve to loosen up. And then I'm fine afterwards. And then it doesn't feel great, but when I have that, I appreciate it, because I think of my patients and people like you who are dealing with this problem on a more consistent basis. Mine goes away, within a moment. But when you can reproduce it like that all the time, that's just telling me that nerve is pretty stuck. And if you get it to move on a consistent basis, it should improve, and you should have some maintenance of the improvements over time, as long as you stay active.
Awesome.
Yeah.
Yeah, and I always am active. This kind of drives me crazy that I can't get my steps in. So I got 10,000 steps in a day for years, and broke that trend last month.
I'm so sorry. Yeah. And I'm sorry about the other knee too. I know you're saying that you're thinking it's going to be where it's at. And so in your case, it might be appropriate to have the knee replacement, and you might be better off quality of life, getting the knee replacement to regain that motion so that you can get on the bike again, or be able to go do other cardio exercise that you like to do. So you're not running into these additional problems like you have been.
Yeah. Cause it drives me crazy, this limp too. And I have been using the cane.
Mm-hmm.
Ever since I've been watching your videos, I've been using the cane, but still the limp doesn't want to go away because it doesn't want to straighten. The odd thing though, it does bend away. I've been working with a physical therapist hands-on, and
great.
I've always had that motion that I'm able to bend all the way, but to straighten, he's unable to get it straight, and I am myself.
Yeah. I know it's tough. Some situations, that's how it happens. And it's unfortunate when that happens. But see, for that's when I'm like, all right, you might be an excellent candidate for a knee replacement. And I love that you're calling here, because you're getting certainty about it now.
Yeah.
And you can walk into the surgery knowing that it's the best thing for you. And keep in mind, like, I would still work out the glutes. I would still do parts of my treatment approach. I get that you are. I'm saying this more for everybody, because then you're going to have a better outcome after the surgery, and you'll be able to maintain the health of your joint replacement for a longer amount of time. So it's good overall. I think you're on the right path. You're doing the right things.
And you know what? I also want to do it for my right knee, because it's perfect, and I don't want it to deteriorate like the left ever. So definitely we'll continue those exercises.
Great. Well, I'm glad you called and we got to chat about this. It's fantastic. Best of luck to you. I hope this gets 100% for you as fast as possible.
I'll let you know how the movement works as I go on.
I would love an update. Please do call us back. Thank you so much. I appreciate you.
Yep. Yeah, have a good day.
You too. Bye-bye.
Bye.
Thank you. Oh, that was good to talk to him because, yeah, sometimes it is appropriate to have a knee replacement. I know I'm the guy that, talks about avoiding joint replacements and all that, but there's a place for them. There's absolutely a place for them. And in this case, when one knee doesn't move as good because you have some permanent losses of motion, it can affect other joints, the other leg, and you start to get these pains that just aggravate in other areas that aren't, things that really just set you back completely. Like you can still get around, you can still do a lot of things, but it hurts. And when that stays there for days and weeks and months, it's a nuisance. And it changes the way you think. It changes your personality in some cases. You're grumpier, and it just doesn't make you want to go do things that are good for you overall. So in this case, it might be good to go get the knee replacement. It might be okay. In the meantime, though, we can do things for that nerve problem and help it feel better so that he can do some bridges or some glute activation exercises to prepare for the joint replacement that might be necessary. All right, so we're going to comments or lesson. All right, let's start wrapping this up for you guys. Where's my pink marker? Done with that one. Let's do number 3 here. This, in my opinion, is going to be the best exercise, but you have to do a few things before you can get to this exercise. I just want to make sure that I'm saying that clearly, that you can't just start on tailgate swings and do that for a few days and then do bridges for a few days and then boom, get to this one. You need to go through the process of getting your glutes to activate and being very conscious and deliberate about using your glutes before you get to walking. All right, now I talk about walking a lot when it comes to knee problems, and you probably often hear me say things like stop walking, and I mean it. If you have knee pain when you're walking, you shouldn't be walking. You need to go back to tailgate swings and then start to activate your glutes with an exercise like bridges. But once your glutes are active, you are using them consistently, and key thing here is that you have been able to contract just one glute apart from the other glute and alternate. You have to be able to tighten your right butt muscle while your left one's relaxed. And you have to be able to switch. Tighten the left butt muscle while the right one's relaxed. That is important. As silly as it sounds, it sounds like I'm talking about some dance. But those of you guys listening, you might not be able to do that. And if you can't, you have made your knee problem worse every step you've taken, because when you go walk, if you don't have conscious control over your glutes and you're able to fire them independently, then what muscles are you using to accomplish walking? You're using your quads very likely, your other muscles. You're compensating somehow, which means you're feeding into the muscle imbalance and adding more compression and forces to your knee cartilage, which is not allowing it to heal. You have to master using your glutes properly, alternating independently, so that you can begin to walk. And then once you can do that, once your glutes are working one at a time and you can alternate them, you have good conscious control over them, now walking becomes one of the best exercises you can do. I highly encourage people to start walking only if you can isolate your glute muscles. If you can just fire the right when you put weight on your right foot and keep the left relaxed, and then fire the left once you switch to that left foot and keep the right relaxed, and you can do that consistently and you practice it and you get better at it over time and you get stronger at it over time as well because you're doing exercises like bridges, then walking is super beneficial for you. You're also using your quads at this point, but less so. You're using your hamstrings and your groin muscles, your inner thigh muscles, but less so. Those muscles are all your thigh muscles. They're working secondary to your quads. To your glutes. Quads, hamstrings, and groin muscles are all working secondary to your glutes. Glutes should be working primarily when you're walking. You should get done with a walk, like 5-10 minutes of walking, and feel like your glutes worked. You should get through the store or go through an intentional walk. Like if you walk at the park, you do a 1, 2, 3 mile walk. You go hiking, and you should feel like your glutes got the bulk of the workout, at least 60, 70% of the workout. It's fine that you're tired in the rest of your legs, your thighs, your calves, your foot muscles. Those are all going to get tired too. but I want you to get your glutes most tired consistently. If that's how you're doing it, then you're helping to repair your knee cartilage because you're putting forces through your knee joint appropriately at that point. You're not overusing the quads or other muscles and compressing the joint. You're putting forces through the joint, but within the tolerance. And if you're walking for longer periods of time, you're doing high repetitions. You're getting thousands of steps in. We talked about cartilage requires thousands of reps. Walking 10,000 steps is about 5 miles. So you're getting high repetitions. The resistance, though, is relative because when you're really in pain and walking was hurting, the tolerance of your cartilage was not very high. So you need to take the resistance to your knee even lower. That's why we did tailgate swings. But as your cartilage heals, as you get better glute control, and you can use your glutes properly while walking, now the resistance to your knee joint, to the cartilage, is relatively low with walking, whereas before you couldn't take that. And then you got to have patience, of course. We talked about that one. So walking is a big deal. Let me show you on the side camera here just exactly how this should happen so you guys get the exercise demonstration. So if you look at my feet and my legs, I'll show you the front side and the back side as well. When I take a step, I'm going to step with my right foot here, and I start to bear weight. I start to put my weight onto my right foot. Then I need my right glute here to begin to tighten up. And it should be not maximally tightened, but tighten about 10, 20% while I'm transitioning my left leg forward to take my left step. And then as I bear weight onto my left foot, I should feel my left glute tighten up. And so that was the big explanation in walking in slow motion, but in real time, it should just look like I'm taking steps. But in those steps that I'm taking, I'm tightening this glute, then tightening this glute. And from the back side, let me tuck this in so you can see. When I take a step with my right foot, this side tightens up a bit, and then left foot, this side tightens up a bit. And so in real time, it just looks like this. I'm just tightening my glutes back and forth as I take steps, and I'm doing it consciously, but also I look casual doing it because I practiced it. I ran a 5K this morning. I ran 3.1 miles, and I was tightening my glutes as I was jogging. I have to consciously remind myself, though. I was listening to an audiobook, but every so many minutes, I'm just like, okay, are my glutes going? I'm thinking about it. I was walking through the store yesterday. I had to go to the grocery store, and I was doing this with my glutes. I just have to remind myself all the time. And I'm the glute guy. I'm the one that talks about it all the time. I still have to remind myself. So don't feel bad if you're watching this right now and you got a knee arthritis problem or a meniscus tear or a chondromalacia patella, and you're thinking, golly, I have to think about this like every 10 seconds or every 5 seconds. That's normal. That's okay. That's good for you to do. That's where you should be because it's hard before it gets easy. And even, you might look at me and say, oh, he did that so easy. He just fires his glutes as he takes steps. I still have to remind myself. But luckily, I'm at a point where I can go run, I can lift weights, I could do pretty much whatever I want. Within my tolerance, it's less effort for me now. It's easier than maybe where you're at right now. So there you have it, guys. We have 3 exercises: tailgate swings, bridges. Tailgate swings are to get movement in, to stimulate the cartilage to begin to heal, because there's mechanoreceptors within the cartilage. There's mechanical cells in there that receive input from motion happening, from the joint bending, that tells it we need to heal, we need motion, we need the fluid to circulate too. Then that sets up bridges. This is where we get the glutes to activate best. And then this is where we really work those glutes in a faster way, in a very practical way, because you all need to walk. You all need to go do stuff. Walking's needed for that. As long as you have the ability to walk, you better be using it properly. Then all these exercises follow these principles. We need high repetitions, low resistance. We need to be working within our tolerance. Don't overdo it. And then we need patience. And keep in mind with that, the doctors give you deadlines that don't line up with cartilage healing. It lines up with their schedule based on how often they want to see you and what the insurances require, depending on what the medical field is like in your country. And then over here, in ways to make it worse, this is so that What will worsen it? Because maybe you're doing some of that, or it's just to give you an idea of the extreme opposite of what we're doing over here. Go do heavy resistance. Go jump on a trampoline. Jump, add weights and do squats or deadlifts. That's going to make your cartilage worse because it's too much. We're exceeding the tolerance of what it can take right now. When you get pain, that's your knee telling you we're beyond the tolerance of what I could take right now. Resting indefinitely. That's bad too, because when you do nothing with your muscles, happens in your cartilage too, but when you do nothing with your muscles, they weaken, they get thinner and smaller. Your cartilage gets thinner as well. It gets you atrophy in your cartilage. How else does somebody who can pick up big weights or run marathons tolerate it? They have stronger, thicker cartilage because they had built up their tolerance through training, through fitness training, through workouts. But if you rest, if you're doing the opposite of training, you're resting, then your cartilage says, well, we don't need to do anything. Let's just get thinner. And that makes your situation worse over time. So it's okay for a short time while it's inflamed, but once it can begin to take a bit more, you have better tolerance, we need to do exercise to stimulate healing. And then the last one is overdoing it. Those of you guys that are gung-ho that you want to get better yesterday, you have to have some patience here and say, all right, I can only work within my tolerance today. I can only do this hourly exercise up until noon, up until 10 a.m. You only did it 3 times this morning before I had to take a break. That's okay. You're playing the long game here. We don't want a joint replacement. We don't want an unnecessary surgery. So just be patient and don't overdo it. Thank you guys for that. I'm still going to answer some comments here. I got a little bit more time. Let me get a swig of water. Stumbling on my words. And let's see who we can help out here. We got Cindy again with great questions. I so appreciate all your videos. The lives are very helpful with questions and answers. Thank you. You're welcome. I'm so happy to help you, Cindy. Absolutely. Let me get another swig here. Thank you guys all so much for joining us here as well. Live on Facebook and YouTube and on Instagram as well. And if you're catching us on the replay, just know that we're trying to be live every Tuesday. I don't think we've missed a Tuesday in a long time. Last week I was out of town, and our recovery coaches, Coach Jay and Raul, stepped in and they brought on Barry as well. Was it Barry? No, it was Frank. I'm sorry, it was Frank. Frank came on, and thank you, Frank, if you're watching. I appreciate you giving your testimonial and answering some questions. So my team is phenomenal. They're jumping up and taking over the live stream when I'm in my absence. So it was great. By the way, if you haven't seen the live stream from last week, y'all got to go check it out. It was so helpful. MR says, it has been some years. My x-ray showed I have no cartilage, but I always walk, even if I take a painkiller, only when it's overbearing though. But lately I've developed venous insufficiency problem. And yeah, sounds like you're overdoing it, MR. And like, let me just break this down a bit more. Taking a painkiller to then go exercise is not a good idea because you're masking the pain and your body's tolerance is not very high. So it's going to lead to you overdoing it. And so this sounds like the type of person who is an overachiever. You're trying to do the right things, but you're overdoing it. And it's difficult in healthcare because that quality in you of being an overachiever has probably served you very well in many other areas. But when it comes to health, you need to be patient. That's the way the body works. You can't lose 10 pounds overnight healthy. You can't fix a cartilage problem in a week or two healthily. You need to take your time to do it properly. There's habits involved. And if you're in the habit of overdoing it and just taking a painkiller to do it, that is not a healthy thing. You're going to make your knee worse. The other part that I wanted to break up here is the insufficiency problem. That's a health issue. Could be related to a heart issue, could be related to what we're talking about here. That tells me that you got some other issues that you're dealing with here, possibly related to overdoing it. The no cartilage thing is the last one that I want to talk about. When doctors say that you have no cartilage left, if they only took an x-ray, They're not telling you the full picture here. They're potentially lying to you unknowingly because the doctor's seen an x-ray which shows bones, not cartilage. And they're deducing, they're guessing that based on your x-ray and there being an image of one bone touching the other bone in your knee, that the bones touching each other means that you don't have cartilage. And I strongly disagree with that because they didn't actually see the cartilage tissue unless they did an MRI. The MRI might show that there's some cartilage or truly a loss of cartilage. But what I'm seeing is that when you think of this imbalance concept where you have very strong quads and it's pulling this kneecap up against the thigh bone and then pulling through this tendon, it's pulling the shin bone up into the thigh bone. It's squashed. It's squashed. You're squashing it. So you're squashing one bone into the other bone. There might still be cartilage there, but it's squashed. If you have a strong imbalance, you're squashing your knee. And just keep in mind, an x-ray is a picture. If I took a picture of you first thing in the morning, you might have your hair all messed up, lines from the pillowcase on your face, and you're just not ready to be shown in public yet. You don't look like you normally do. But if we can give you a few minutes to freshen up, you'll probably look like you normally do. Same thing with your knee. If we can take that muscle imbalance away and depressurize the knee joint, it'll probably look normal and no longer bone on bone. But doctors aren't trained in that, and they're just looking at the x-ray and telling you, oh, it's bone on bone, stage 2, stage 3, stage 4. Here's the treatment. Let's try this. Give it a month or two. Come back. Give it another month or two after the next treatment. Come back. Oh, none of that worked? All right, let's do surgery. They're jumping you through these hoops too fast. And it's because that's their training, and they're doing the best they can with what they know. But you guys are here to learn different. Good comment there, MR. We got AG saying, what do you do if it's both knees? How do you offload? Yeah, great question. In my opinion, the best thing to offload is to use crutches, to offload both legs. Because with crutches, you can usually get better support since this can go under your arms. I don't have the other crutch with me right now, but if I had both crutches, you can swing both legs through, but you're still going to have to put some pressure. You're just going to go slower. But you can still use the walker as well. You're just going to go slower. But I would still offload because even if you're still hurting using the walker, you're hurting less. You're irritating it less by offloading at least a little bit on between both sides. So you just got to start offloading. That'd be my best advice. If you were here in the office with me and I told you offload with a walker and you said it still hurts, I would say, what percent less though? Or what percent has it improved? And if you said 10, 20%, I'd say, great, let's start there. If you only had one side involved and the other, you could put pressure through your other knee, you could take off 100% of the pressure and get it 100% improved in that moment where you're offloading. At least you're getting some improvement. And I would go with that because you'll hit a threshold where you improve enough to put more pressure through your legs and you can really offload a lot, or you can begin to get to the other exercises that can make some big improvements. You just have a bit more to work through if you have both legs involved. Great question, AG. Sugar says, why would my tailgate swings hurt when I just barely let my legs hang for a little while? Great question. When tailgate swings are painful, it's such an easy exercise. I'll just to show you again what this looks like. You're just swinging your legs back and forth. Give it a second. They're coming over. Yeah, there we go. You're just swinging your legs back and forth. If this hurts you, then it tells me that you are so irritated in your knees right now that even small, tiny motions with no weight are hurting you. You're that irritated. So what I would recommend is that you actually need to rest a little bit and try the tailgate swings, but you might not be able to go 5 minutes at a time every hour. You might need to do 30 seconds, 10 seconds at a time every few hours. And basically do as much as you can without it hurting worse. So if you get away with 10 seconds of tailgate swings before the pain comes on, do that, stop, wait an hour, then come back and do 10 seconds again. And you're basically just trying to get in what you can because that little bit that you're getting in is moving the fluid and is stimulating the cartilage cells to begin to heal. It's still beneficial. you just are starting from way down here instead of somebody who can do them all day without any issues. They're starting from up here. They still have a long road to go as well, but you're better off starting with something here, 10 seconds worth of tailgate swings every hour or a few times a day, because that's going to move you in the right direction. You're going to get to the point where you can tolerate more exercise. You can begin to do some glute exercises. You can begin to get on your feet a bit more, and you'll be on your way to healing this problem without surgery. But you got to start there. You got to start in a place that doesn't hurt. I would look at offloading as well. Make sure that you're offloading, because that's probably what's irritating you the most. Good question, Sugar. All right, we got, I can't pronounce that. I'll just call you Jay. Should I be thinking about my glutes as I do tailgate swings? Generally, no. If you can, I would separate those exercises, because I'll tell people to sit like I did for the tailgate swings and then tighten their glutes. When you tighten your glutes, it takes some good concentration, especially if you're not used to doing it. And trying to throw the tailgate swings into it might be distracting from getting a good glute activation and truly paying attention to make sure that your quads aren't working, that your thighs aren't working. So I would separate tailgate swings from glute activation, because in tailgate swings, you're technically using your quads a bit, but the point is not to aggressively activate your quads. The focus is to get the fluid to move inside your knee joint, to stimulate the cartilage cells to heal. So we're doing very light movement, and I would want you to just focus on easy movement. That's tailgate swings are so subconscious for people once they get it. You can watch TV, you can have a conversation and do tailgate swings. I'd rather you do that and then spend some dedicated time to think about the glutes working. Good question there, Jay. Cheryl's back. Sorry, one more question. I love it, Cheryl. What is your thoughts on nerve ablation for continued knee pain after the total knee replacement if you have been doing glute exercises? That's a good one. So I'm usually against the nerve ablation procedure. And the reason is because if you haven't had surgery yet, but this is different. You're asking about somebody who had a knee replacement. If you have not had surgery yet, you very likely need all the nerve feedback you can get in order to fix the problem. Because the nerve ablation procedure, just to show you on the knee joint here, it's a branch off the saphenous nerve. So here's the knee joint. This is the right knee. And the nerve comes down right here. And the main branch keeps going down, but there's a little branch that goes right around the front of the knee joint right here, wraps around the front of the knee, in line with the meniscus usually. So there's often a mistaken meniscus pain, but it's the recurring branch of the saphenous nerve. That's the name of the nerve. And so what they'll do with the nerve ablation is they'll come in here and burn the nerve so that this nerve dies, essentially, and you don't feel pain anymore. If you've had a knee replacement, you've had the joint replaced. So you've already had a big procedure, and it's possible that part of your knee pain is related to the scar tissue and all the incisions that were made, the bones that were cut out. There's major surgery done to replace your knee joint. It's possible that there's something related to that going on. I'm more open to you doing a knee ablation procedure if you had the knee replacements. However, I would still want you to focus on fixing the root muscle imbalance, even though you have a knee replacement. Those of you guys that have a knee replacement, you still need to do some work. This muscle imbalance problem doesn't go away with a knee replacement. Once you go through a surgery, it doesn't fix everything. It just takes away the surfaces of the joint that have arthritis on them, but you might still be moving inappropriately. Your glutes might not be strong enough. You might still be very quad dominant, and so it's pulling on your nerves. It's pulling on the tendons and ligaments in the area and causing pain otherwise. That muscle imbalance can cause so many different problems. So I would not want you to skip fixing the muscle imbalance. But if you're truly working on the muscle imbalance, you're fixing the glutes, you're not focusing on the quads, then I would say, you know what, you're working hard. Maybe it is time to do the nerve ablation procedure. Good question, Cheryl. Now we got Jimmy Long, who says, Doctor, what is your opinion of radiation therapy on 2 arthritis knees? Thank you. It's not fixing the muscle imbalance for sure. I wouldn't want you to do it unless you have no other option for pain relief. So just understand, let me say this differently. Just understand that the idea of radiation therapy, that's usually for cancer treatment. So I don't know why they're doing it why somebody might be recommending it for arthritis. And maybe there's some other procedure that I don't know about. and they're thinking that radiation therapy might help knee arthritis, but it doesn't fix the mechanical movement, but it doesn't fix the forces going through your knee joint, which is what I'm talking about with all this stuff. So you would only look to do this to relieve pain. I don't think it's a good idea. Plus all the radiation exposure, there's serious risks to radiation exposure. People that go through radiation therapy for cancer treatments, it's not fun. And the doctors, you're killing cells. So I don't think it's a great idea. All right, we had I thought I saw a highlighted one there. Yeah, we got a super chat. Oh, Kimberly says almost 1 million subscribers. You're greatly appreciated. Thank you, Kimberly. I appreciate that. Yeah, we're right around the corner from 1 million subscribers, which reminds me, if you're watching this right now and you haven't subscribed to us, forget the 1 million subscribers. Like that's cool. It's a cool flex and all that stuff. I just want to help you. I just want to make sure that you get information that is best relevant to you and best helps you. And for me, the 1 million subscribers is just showing us that there's been that many people that have trusted us. So if you don't want to miss any of our videos to help you fix knee problems like osteoarthritis, meniscus tears, condylomalacia patella, knee cartilage issues, hit subscribe if you haven't subscribed to us yet, so that you catch our future videos and you get the right kind of advice, not the advice that leads you to surgery. If you have a good chance of avoiding it, which most people do, this is the channel where you're going to find the information that's going to help you avoid it. So hope you guys subscribe. Thank you, Kimberly. I appreciate that. All right, last question of the day here. We got Kate. She says, don't be embarrassed using a cane. Be grateful for the tool. Yes, it's such a common thing. It's an unspoken thing. And some people will proudly say that they were embarrassed. They say it after the fact, by the way. They'll say, I finally started using the cane. I finally started using the walker. And after they've been wrestling with the thought of getting it and using it for months. And then what they follow up with is, and I feel better. I should have been using it a long time ago. So that's excellent advice. I love it. All right, guys, we're going to wrap up here. Thank you all so much for joining us, and I hope that you were helped. We'll be here next Tuesday. Don't forget to subscribe. Share this with somebody you think needs to see this, and give us a thumbs up. That helps us out to get more views here on YouTube so that we can help more people. Thanks, guys. Catch you next week. Bye-bye.